Good evening, and thank you for joining the Greenburgh Central School District Community Meeting. I am Dr. Iverson, and I am the Superintendent of Schools. This meeting this evening is being supported by our Board of Trustees, as well as our Central Office Administrators and our building level administrators. Collectively, we have looked at this guidance and we have now updated our reopening plan. And my purpose tonight is to share those updates with you as we plan for the opening of school. So welcome. We received the final reopening. We received the final reopening guidance August 12th. The goals of that guidance was to give districts assistance in how to plan to keep students safe and healthy when they return to school, to help us be responsive to their needs and maximize in-person teaching and learning. This guidance was compiled in collaboration with the New York State Department of Education, CDC, and the American Academy of Pediatrics COVID-19 for Safe Schools. It's intended to be used by all local school districts and agencies. And we have taken this guidance and we've aligned our district reopen plan to include and adopt the recommendations. In-person instruction. The guidance stipulates in-person instruction. The overall goal for the school year is to maximize in-person instruction. So schools will open for in-person teaching and learning, and students in Greenburgh Central School District will be in school full-time 5 days a week. The guidance does not require schools that are open for full-time instruction to provide online or remote instruction. But what the guidance does stipulate is that schools, while open in person, have a layered approach to mitigation strategies so that we are able to support our students in a healthy environment. Layered prevention strategies are throughout the guidance. The guidance is very repetitive. And every section of the guidance, there is language around layered prevention strategies, meaning having multiple strategies all at once simultaneously in place. And they include masking, testing, improved ventilation, desk shields, which we have reinstituted here in Greenburgh Central School District, hand washing, staying at home, we know when you're sick, and get tested, contact tracing in combination with quarantine and isolation, physical distancing, and routine cleaning and disinfection of the school environment, all to promote a safer environment for our students while in person. All of these are in place in Greenburgh Central School District. And we know this is particularly more important now because we have many of our students who are under 12 who have not and cannot receive the vaccine. So it's important that we have these layered strategies in place as they return to this in-person environment. So as we look at the levels of transmission, school districts are to continue to use this chart and this data to determine when to move to another mode of instruction. As you've seen this before, it's the cross-section of indicator and level of transmission indicated by color. So blue being low transmission, yellow, moderate, red, substantial, based on the number of cases and the percentage of positive cases. The next chart shows now how that level of transmission coincides with recommended physical distancing. So if you notice in all colors, the recommended language from the New York State Department of Ed and the CDC is that whether we're low, yellow, or red, elementary schools are to have physical distancing at least 3 feet. The exception is when we have our sports and extracurricular activities down the bottom. As much as possible, we will be using 6 feet distancing outside to the greatest extent possible. We know the Delta variant is alive and is in New York State, and it has been found to be the most prominent strain of this COVID-19 virus that's circulating. And this is one of the most significant changes in our guidance this year. The data shows that the Delta variant is even more contagious, and it represents a threat, particularly to all of our unvaccinated individuals. So what I want to go through now are some of the generic key takeaways from the guidance. And then later on, I'll get into some of the specifics in all of the various areas. These are generic in nature. The guidance still stipulates, as it did back in March 2020, stay home if you're sick. They define sick as having a runny nose. Do not come to school, do not come to work, and keep children home if they show any of the signs of that are symptoms of COVID. The guidance, again, emphasizes this layered prevention of strategies, which I've talked about. We have all of these in place. And we talk more about how critical this is to protect our students, our parents, and our faculty, and our district at large, especially while we're in person. Some more key takeaways that school districts and localities, we are to continue to monitor the transmission. The charts I just showed you, vaccination coverage, which is new language in the guidance, screening, testing, and the occurrence of outbreaks to guide decisions on the level of layer prevention strategies. In other words, depending on an outbreak, we may have to add more layered into prevention strategies. But that data is what we look at to guide that decision. Again, schools maintain at least 3 feet of physical distance between students within classrooms, combined with indoor mask wearing by people who are not fully vaccinated. This was in the guidance, as I said, as of August the 12th. As late as last Friday, our new governor has issued a mandate that vaccinated or not, all masks must be worn indoors. This is how fluid this guidance is. Screening, testing, ventilation, hand washing, staying at home, again, layered prevention strategies we are to continue to do. And the guidance added this very strong statement. Vaccination is currently the leading public health prevention strategy to end the pandemic and is more urgent than ever as we respond to another surge in cases. Temperature and questionnaire screenings. CDC no longer recommends that we do this. Greenburgh Central will no longer use the temperature screenings and the screening questionnaires. We are asking our families and families to just remain mindful of indications that your child may exhibit any of the symptoms of COVID-19 and keep them home and seek testing. School students and school personnel should stay home if you're showing signs. School closures due to COVID. So Greenburgh Central will be open for full in-person instruction. This is the only option provided to students. However, in cases of school closures due to a declared public health emergency, we are prepared to provide remote instruction and learning opportunities that are responsive to the needs of our students on a case-by-case basis. In an individual student case, asynchronous assignments will be downloaded via the Google Meet platform, and we will provide some support to the students by a TA. If an entire class must quarantine, even the teacher, in that case, live streaming remote instruction will be provided by the classroom teacher. If we have to move to the cohorting phase hybrid approach due to COVID, our cohorts have been updated and students and all siblings have been placed in the same group. Our transportation rosters have been updated and our students have been assigned to learning locations. This information was sent home, by the way, parents, in the opening packets back on August the 13th. Mask wearing. We have adopted the order from CDC here in Greenburgh Central. So all of our staff, teachers, visitors, anyone in our building, vaccinated or not, will wear masks. Mask wearing applies to all forms of public transportation, including on our buses. All students and bus drivers must wear masks on school buses. They must be worn for school events and athletic events while indoors. And the CDC recommends that people who are not fully vaccinated wear a mask in crowded outdoor settings or during activities that involve contact with people who are not fully vaccinated. But indoors, vaccinated or not, masks will be worn in Greenburgh Central School District. Face masks will not be required to be worn outdoors on school grounds, including during outdoor sports. Students will be allowed to remove their face coverings for breaks and, of course, during meals, instruction, and sometimes during instruction, and as long as they maintain the appropriate social distance. And students who are unable to medically tolerate a face covering will not be required to wear one. Social distancing. CDC recommends the 3 feet distancing in classroom settings, combined with those layered prevention strategies. So for teachers and students who are not fully vaccinated, 6 feet distance between students and teachers and between teachers and staff will be maintained to the best extent possible within the structures of the building. Physical distancing, though, is not required on school buses. This is how the CDC and the guidance we received defines close contact and duration of exposure. These two data points and these two pieces here are very helpful to me as when we have a case of COVID to determine when contact happened and what we do next. So an infected person, we have learned, can spread COVID-19 starting from 2 days before they have any symptoms, or for asymptomatic persons, 2 days before the positive specimen collection date, 2 days before they're tested positive. Within 6 feet of an infected person, and this has of course been confirmed by laboratory, for a cumulative of total of 15 minutes or more over a 24-hour period. For example, that 15 minutes could be over 2 days. It doesn't have to be in one sustained block of time. The exception to close contact and duration of exposure is here. In the K-12 classroom, indoor classroom setting, the close contact definition excludes students who were within the 3 to 6 feet of an infected person, lab confirmed, when both students were engaged in consistent and correct use of well-fitting masks, the prevention strategies were in place, and such as the physical distancing, ventilation, mask wearing, hand washing, all of those layered strategies that are throughout the document. When they are in place, that's the exception. But this exception does not apply to teachers, staff, or other adults in the indoor classroom setting. Child nutrition. The district will continue to maximize physical distancing as much as possible when students are moving through the food and service line while eating indoors. And many of our buildings, our principals have identified additional spaces where we can even make our spaces, put less students in the environment and spread them out more. We will use those additional spaces in the building and in classrooms and wherever we can, and use outdoor seating if possible. Recess and physical education, wherever possible, they will be held outside to encourage the spread. The playground usage will be scheduled, and the district will limit other playground activities where groups gather together. But students will go through that washing of hands before and after touching playground equipment. And when physical education activities or recess are held outdoors, people who are not fully vaccinated will be expected to wear masks and maximize the distance when possible. Field trips will be canceled until further notice. In our sports and extracurricular activities, coaches and sports administrators will consider sports-related risk factors such as what's listed here. I have met with Mr. McCoy, and he is taking all of these factors in consideration when he's planning sports activities. Practices will be held in groups. Machines are spread out in the fitness center and they're cleaned between groups. The bleachers will be marked off by 6 feet apart signs, and they'll be posted throughout the facility, and only 2 spectators per athlete will be permitted during the games. And both our soccer fields will be used for games. High-risk sports and extracurricular activities that will be virtual as much as possible or canceled in areas when we have a high community rate of transmission. People who are fully vaccinated can refrain from quarantine following known exposure if they're asymptomatic, facilitating continued participation in in-person learning, sports, and extracurricular activities. Vaccinations. This was a large section in the new guidance, a lot of content there. And clearly, people who are fully vaccinated are at low risk of symptomatic or severe infection. We know that. People who are fully vaccinated no longer need to wear a mask or physically distance in any setting, including while participating in sports and extracurricular activities. Again, in Greenburgh Central, vaccinated or not, we all will be wearing masks inside. People who are fully vaccinated can refrain from quarantine following known exposure if asymptomatic. However, fully vaccinated people should get tested 3 to 5 days after that exposure, even if you don't have symptoms, and wear a mask indoors for the 14 days until you're negative. We as school districts can require universal mask wearing regardless of vaccination status, which is what we're doing in Greenburgh Central. And having a student population is not eligible yet for vaccination is why we must do this. Increasing or substantial or high COVID-19 transmission within the school, could be a case, could happen. So we need to have our mask on. And we know in the community there could be increasing transmission of this variant that is spreading more easily among our young children. And for that reason, mask wearing, regardless, is going to be required in our district. Lacking a system to monitor the vaccine status of students and or teachers and staff. We do not have a system to monitor who's vaccinated and who isn't. And this is another reason why whether you're vaccinated or not, we're all wearing masks inside. Difficult with monitoring or enforcing mask policies that are not universal. Awareness of low vaccination within the student, family, or teacher, staff population. We just don't have that knowledge. We have no control of finding out where kids are vaccinated, who is and who is not. And for these reasons, this is why the mask wearing is such a strong language in the guidance. Testing, the CDC recommends that COVID-19 testing in schools for unvaccinated teachers and staff. I will announce that we have coordinated with Westchester County. They are in the process of developing a partnership with outside labs to bring testing on school sites. Greenburgh Central has signed up to be one of those sites. We're waiting on more information. They're in the process of working out the logistics. The goal is to have this clear message to our communities about using testing to stop the spread of this disease and this Delta variant. And the school being a site for the testing is free to us and our staff and our community. And if we decide to do this, we will work out the logistics with the county and how that will happen. More information to come, but we are signed up to be a testing site. Schools can routinely test student athletes. Once we have this on site, this becomes very available to us to do these things here. And we're hoping that this will support our vaccinations and support getting more people vaccinated in our schools. So this past week, all faculty and staff received a voluntary vaccination staff survey. It was sent to them via the school messenger. They have until September 1 to respond their answers. The survey was voluntary and was anonymous. It asked 4 simple questions. And what we're going to do is use these results to determine if the percentage of unvaccinated staff or persons in our district, right here in Greenburgh Central School District, is problematic enough to look at another layer of prevention strategy to implement. Transportation, bus students have been assigned. We're encouraging parents who can transport students to do so, but masks will be worn by all students on the bus, including the driver. Students will be seated 2 to 3 on a seat. The buses, though, are cleaned thoroughly before and after every run. And during transportation, as much as possible, we will keep the windows cracked, if not even open, as long as it doesn't pose a safety risk. Social and emotional well-being. We're going to continue to provide our families with all the available resources that we find and have and referrals to address any of the concerns, emotional behavioral needs of our students. We are planning professional development as a staff to better engage and learn more about social emotional learning so we can better support our students while in our care. And all district, we will be engaged in PD starting on September the 2nd, where we will hear from a pronounced researcher who's done a lot in this area, who will give us some strategies to begin to work with day one. Know that we will be looking to implement a systemic program around social and emotional well-being. We're right now looking into a couple, and stay tuned for more information about that. Health and safety, the district's going to continue to deploy the signage all throughout the buildings. Was in many of the buildings today, and the signage is clear and posted all through the halls and on the walls. We're going to continue with our protective PEE equipment, our face coverings, all of the layered prevention strategies I've mentioned throughout this presentation. Facilities, our schools facilities look good. Our school buildings, buses, and office spaces are going to be cleaned at least once a day to remove germs that may be on surfaces. And of course, in the evening and before and after school. If the school building has anyone who tested positive within that 24 hours, that space will be cleaned and disinfected as soon as possible. Ventilation is a new section added to this guidance. And here again, the layered approach to reduce the exposure to COVID through ventilation. And this approach includes multiple strategies, including improvements to building ventilation to reduce the spread of the disease and lower the risk of exposure. So what we've done here in Greenburgh Central School District are these strategies listed here. Opening multiple doors and windows will continue to do as long as it doesn't represent a hazard. We're using fans to increase the effectiveness of open windows and retrofitting the HVAC systems to improve the infiltration. Visitors and volunteers will not be permitted in the schools at this time. We need to limit the exposure of COVID or the potential of that. And we find that not having visitors and volunteers just voluntarily in the building helps to mitigate that. Activities involving external groups or organizations right now will not be permitted in the school. We will be having student pictures, but they will be taking the pictures on the school grounds. And field trips, as I said earlier, will be canceled for right now. So in closing, that is the guidance. I wanted to say to you that we are doing and will do and committed to doing everything in our power to assure that we have a safe and healthy environment for our students when they show up September the 9th. We will now open it up for questions. If you want to put questions in the chat, we have someone who's prepared to read them, and or if you want to raise your hand, we can address your concerns. Ivy, can you?
Yep. The first question is, how many instructional vacancies are there currently in the district? Is there a plan to ensure schools are staffed in the event several teachers are required to quarantine, creating staffing shortage? We are heavily in the process of filling some vacancies. We hope to have some on the board agenda for our board to approve. We will take it as it happens. We don't have a plan in place of who will cover when that happens. A lot of this is case by case, and we are on the spot. We'll make sure classes are covered. I did cite for you that in cases of individual cases of COVID, students will get their work asynchronously downloaded by the teacher. And in cases where there's full exposure and we do need to close a classroom, we will put TAs in those spaces. But we will have to just take it one day at a time and take it case by case. What percentage of staff is vaccinated in the district?
So the survey I mentioned will be closing September 1. I will have that data then.
Why is distancing not required on buses?
The guidance just doesn't, the guidance stipulates that. We're following the guidance. CDC, the New York State Department of Ed, Westchester County of Ed, the Department of Ed, all have come together and collaborated with this language. And so we're just simply implementing that.
If someone at school tests positive, what is the quarantine timeframe? Will school shut down like last year?
This is, again, case by case. When we have a case reported, I call the CDC, I call the Department of Health, and the CDC, and I take guidance from them. They ask questions of me. We do all the contact tracing, and that decision is made collectively on the spot. It's just impossible to give a certain routine that we do that to say how each case will be. We will follow the guidance of the CDC and assure that we follow the protocol and reporting it to the Department of Health.
Are teachers and staff required to be vaccinated?
No.
If there is a quarantine needed, can children test back in, and if so, when?
I'd say that again, if you could repeat the question.
If there is quarantine needed, can children test back in, and if so, when?
So if anyone's in quarantine, if you're home quarantine and you're not showing any symptoms, you're asymptomatic, the guidance says between 3 and 5 days, you must get tested. If your test results come back negative, you can come back in. If your test results are positive, you remain out for the duration of the quarantine.
Are there any different rules for pre-K?
No. This is for all students.
Are bus staff required to be vaccinated?
Mr. Burns is on the call. I'll let him address that answer.
You can't
Mr. Burns, we can't hear you. Can you unmute?
This is the first time he's speechless.
We'll come back to him.
Yeah. Fran, try muting and unmuting. It should work.
You may have to log out and log back in, Frank. We'll come back.
Okay, Ivy, go ahead.
Will in-person tours for orientation be offered prior to the start of school?
No, back to school night will be virtual. Our principals are doing virtual tours as well. So that will come along with back to school night, but there is no in-person back to school night or activities.
Will you continue to notify all parents if there is a positive case at the school?
Yes, those that are pertinent and need to know that as much as possible, we try to sustain and maintain confidentiality. And with the contact with the CDC, they somehow direct who needs to be contacted, and we will follow that protocol.
If there is an exposure in an elementary class that has their masks off during lunch together, who will be required to quarantine?
Again, that's a case-by-case scenario. Once that happens, the investigation, we will do the investigation and get the circumstances reported and be directed by CDC on who would need to quarantine. It all comes back down to who was within 6 feet, 3 feet distancing, were all the mitigating strategies in place. All of that is part of the investigation to determine what we do next. There's just not a cookie cutter answer to each and every scenario. We treated each one individually and we act accordingly. And our decisions around some of these cases are different each time, as long as we're following the guidance of the CDC. So it's just hard to answer scenarios like that when we just don't know the magnitude of what that is, how many kids, what that contact was, just where it was, how much of a contact it was, who was involved. That is all part of the investigation. It takes some time that we spend when we have a case before we know who needs to be quarantined, who can stay in school. Do we need to close the class? Can that class remain open? Do we need to do synchronous? All of those are the things we look at as a case comes up, but it is a case-by-case basis.
Are student schedule adjustments going to be handled at the middle high school if visits are not permitted?
Is Mr. Brady on the call to answer that? We can get back with that answer, Ivy.
If there is an exposure on the bus, will the whole bus need to quarantine since there is no social distancing?
Yes, Mr. Burns, are you able to unmute now? No. He's not.
I had him on the phone just a couple of minutes ago. If you would like, I can try calling him and maybe transferring or put my phone up to the screen.
Is his volume turned down?
I'll call him again.
We'll keep going and come back. Ivy, keep those two questions in case he's not able to unmute. We can definitely get an answer out.
Do we have subs to cover if we have multiple staff out again as we did last year? Would we switch over to remote learning in that case?
That's a decision we'll make on again when it happens. We do have subs. I would not say we have subs for every scenario for every class. Subs across the nation are hard to come by, and so we're always recruiting subs. We will look at it. We have TAs. We can use them as well, and we will take our staff and reassign them to the best possibility we can based on that scenario.
Who do parents reach out to when they have COVID questions? It had previously been Dr. Reynolds.
So right now, I'm that person. They can reach out to me. You certainly can reach out to the school nurse and the building principal.
My incoming kindergarten has seasonal allergies and gets a runny nose regularly. Will he need to stop from school for every runny nose?
So that's a good question. I would say to you that that's a nurse question to answer. I would hope not, but we do need to take that consideration. So I don't have an answer to that. That I will have to check with the nurse on that, how that's been handled, because we do know this is allergy season and we don't want to misdiagnose. We don't diagnose at all. We just know that is a symptom of COVID. And so to be safe and, possibly you will be asked to get something from the doctor to document that it is allergies and not COVID. We just have to be precautious in that manner. But I will talk to the nurse around how that's been handled in the past.
If quarantine is needed, what is the length?
Right now, they're staying home between 10 and 14 days. The last couple of times we had one in the summer, it was 10 days. And again, that was determined by the CDC and the Department of Health when I called them. Based on when that contact tracing or when that exposure happened, they calculate from there. And sometimes it could be 10 days, it could be the remaining of 5 days. They look at when that exposure happened and they start calculating from there. But mostly the maximum has been 10 days.
How have cleanliness protocols changed since last year to deal with the new Delta variant, specifically for items shared between students?
Well, we won't share items between students. That's still one of our layer prevention strategies. Students do not share scissors and crayons and paper. That's not going to happen. And how it's changing that we are adding more layers of prevention. The desk shields are back up and we're just doing more and more levels of cleanliness on a routine basis.
You mentioned surveying staff to see what percentage are vaccinated. What is your target for percentage of staff to be vaccinated before needing to implement additional measures?
We don't have a target. We're going to wait to see the data and make a decision then. I know other superintendents as well are surveying their staff. Truthfully, we're all waiting for further guidance from our commissioner around what that percentage should be. It's certainly not something I want to make the determination on. I'm not skilled to know what percentage that should be. We hope the percentage is high, that they are. And so that 10%, for example, say if 90 are, that percentage is what we can work with. But we don't have a cutoff percentage. This is simply to find out how many, and we'll take that data and from there decide what we do next. This is just the first step.
Westchester Department of Health is requiring 10-day quarantine with no option for testing out of that. Has Greenburgh received alternate or differing recommendations regarding your 3 to 5 day change?
No.
If there's no remote model and I get a call that my children are exposed and are told to quarantine, how will they continue to get uninterrupted instruction?
So again, that's case by case. If the individual cases, your children will receive asynchronous instruction through downloaded lessons through the Google Meet platform and during the 10 days of quarantine. And they will get support from a TA to check in for that conferencing. That is the continuity of instruction model for remote instruction when we have individual cases. If we have full whole classes that need to be quarantined, including the teacher, that's when live streaming instruction will happen. Those are the only two cases or scenarios when there's going to be a form of remote instruction. And they do count as continuity of instruction because we'll continue, that continuity is the students are still engaged in a mode of learning. We just simply cannot provide live streaming instruction for 1-2 students because that teacher, while those is also in class in front of 15 more. So we do have that in place. So as soon as that happens, there is that continuity that students will work on assignments connected to the instruction they were engaged in prior to having to quarantine.
Will some teachers still be permitted to teach from other rooms?
Yes.
In the middle and high school, where all the kids are above age 12, do we know the percentage of those who are vaccinated?
No, again, that is very personal information, it's confidential, and no one has to share that. So no, we do not.
What is the class size for each grade level?
Okay, so we can go, the principals are on the call. Can we begin with the Miss Mail? Can you start ECP? Then we'll go to we'll go to Miss Simone, and then we'll just go up the line. What is your class enrollment by class?
The average class enrollment at the early childhood program is 18 children. unless there is a state mandate with a particular classroom having to be with a certain ratio.
Thank you.
You're welcome.
At the Lee F. Jackson School, the contractual max is 22. Currently, as of today, the class size are between 18 and 19.
At Highview School, our second grade classes are in the low 20s, the average, and third grade is right now averaging in the high teens.
At RJ Bailey, we're averaging in the low 20s as well.
Thank you.
Will lunch tables be assigned so you know what students were possibly exposed?
Does any principal want to take that one? Yep, Ms. Simone.
Yes, we have 4 lunch periods. Each lunch period has assigned classes, and each table has assigned placement.
Mr. Mastrangelo.
The same at Highview School. We have 3 different colors of tables, red, blue, and yellow. The students will go to the same tables every day, and essentially they sit at the same spot every day, but in between lunch periods, the tables are wiped down and disinfected.
Yes, Ms. Rossi.
The same holds true at RJ Bailey. We have different colored tables, and each class will sit at their designated table at the same time, at the same place each day. And the tables are wiped down between students.
Did you want to add something, Ms. Mayo?
Yes, at the early childhood program, the children will be eating in the classrooms, and they will be at their appropriate distancing, and the area will be cleaned and disinfected.
Will children move to different classes this year, or will the teachers be pushing in, specifically asking for RJ Bailey?
At RJ Bailey, the teachers will be transitioning from class to class. The students will remain with in their home base for all periods except for lunch and PE. And PE, as long as the weather permits, we will hold it outside.
Do we have enough space to allow 3-foot social distancing for each class at every grade and school?
So the 3-foot distancing is recommended, as I mentioned, to the best extent possible. I know the principals are religiously working to assure that we try to sustain that in the room. That's why the layer prevention strategies is what stressed throughout this guidance, because in cases where that cannot happen, the guidance says the layer prevention strategy should be on place. So simultaneously, 3 feet distancing, in-person instruction, and layer prevention strategies. So that is going to be sustained and maintained to the best extent possible, but consistently across the district in every building will be these prevention strategies while students are within this 3 feet.
Ventilation has been an issue with the various buildings. Would it be possible to get an update on the status of each building?
Mr. Falcone.
Okay, I'm sorry. What was that question again? The ventilation?
Ivy, could you read it again?
Ventilation has been an issue with the various buildings. Would it be possible to get an update on the status of each building?
Okay, well, the ventilation is at status quo, exactly what happened last year. We ended up putting new exhaust fans on the roofs. We opened up all air dampers for any HV units that are in every single one of the buildings. As far as Bailey School is concerned, we put fans in the window to induce drafts. They have a natural exhaust. So we're getting fresh air constantly in the classrooms, as well as ECP.
Can you speak to the other schools, Mr. Falcone? The question was for each school.
Highview School, a third of Highview School is an HV unit, so it's bringing in fresh air. The other 2/3, or yeah, it's about 2/3 of the building is worked on negative air. So we have exhaust fans in basically every room in that building that's exhausting the air that comes out, that forces fresh air to come on in. LF Jackson has an HV unit for the whole building. So those dampers, you've probably seen the pictures, are wide open. We propped them open, and that's a constant fresh air coming in to LF Jackson.
Going back to a previous question, are bus staff required to be vaccinated?
Is he able to?
Do we work now?
Yes.
Oh man, check it out, huh? Okay, bus staff, a lot of them were apprehensive when it wasn't approved. We're at about 70% right now, with more coming because they have called. At least one shot, 70% of the staff. The office staff, all the mechanics, myself, are all vaccinated, but yes, 70% I would say is the number as of today.
If there's an exposure on the bus, will the whole bus need to quarantine since there's no social distancing?
We take attendance. When our case is reported to us, I take the attendance sheet from AM and PM. If it came the day after, whatever's required of us, we send that to the superintendent of schools, and then they work with the nurses and the CDC and Department of Health to decide who gets quarantined.
Since parents aren't allowed to accompany their kindergartners in school, who will accompany the smaller children to and from their bus?
Ms. Simone?
So we have, the staff has early bus duty, and they're staggered around the building. Our school safety officer, Mr. John, and our monitor, Ms. Tanya Jones, are out front. We have different staff at each bus with walkies. We let a few off at a time. They walk into the building, and then within the building, we have bus duty assignment where they're guided to their classroom, and the teachers welcome them at their door.
What is the threshold for the number of students in a classroom testing positive that would trigger the decision to quarantine an entire class?
So those are the two data points that I mentioned through the presentation. We'll look at the level of transmission in the classroom, and we will report it to the CDC. There is no threshold that they've given us to use. The direction is when it happens, call CDC and we will tell you what that threshold should be. So the two that we know so far, if the whole class is quarantined, we know that we will then again do the ACE, the live instruction. But right now, single cases as a case by case basis. So I just can't answer that question. There is no clear answer to that, not even in the guidance. The guidance just gives us direction on what to do when it happens, and we follow that guidance and call, as I've said, the Department of Health and CDC, and they give me guidance on what should happen. Because we aren't experts at this, they know that we need help, and so we're told to call them.
With respect to the earlier question regarding allergy season, our nurse coordinator wrote in the chat that doctors can write medical notes for allergy season. Next question, are there any other days this week where schedule adjustments can be arranged for Woodlands Middle High School students?
We can get that answer. Mr. Smith is not able to be here, and I don't think Mr. Brady's on either. So I can get that answer, but I don't have an answer tonight.
Is remote learning an option?
No.
Will students at RJ Bailey be moving to different classrooms throughout the day, or will teachers move to each home classroom?
Again, it's the teachers that are going to transition to the students.
Can you please expand on what unmasked situations like lunch will look like? How many kids are in the lunchroom at one time at Lee F. Jackson and Highview?
As I mentioned earlier, we have 4 lunch periods, and each lunch period houses approximately 3 classes. And what our system is, half of the students are in the cafeteria having lunch while the other are at recess, and then they alternate. So this way it minimizes the amount of students that are in the cafeteria, and it allows them to have that distancing and have no more than 3 to 4 students at a table.
And at Highview School, it's very, very similar, even though we only have 2 lunches. Let's break it down this way. In second grade, for example, there are 110 students, but the second graders, while half are having lunch, the other half are at recess. So you're only looking at 55 in the cafeteria. However, of those 55, there will always be a class, one class eating lunch outside, and they will be set up on a 3-day rotation. So on day 1, class X is outside. On day 2, class Y is outside. On day 3, class Z is outside. So at no time will there be more than 35 or so students in the cafeteria that can hold about 110. So we're pretty good ratio of separating the kids throughout the cafeteria. In second and or third grade, it doesn't matter.
Will staff be tested weekly?
No.
Who will monitor and make sure lunch tables are thoroughly cleaned after each seating?
Anyone want to take that?
At RJ Bailey, Mr. Washington has been adamant about working with the neonates, the monitors, and myself. And so we are there and we assist them in making sure that the cleaning is done properly.
Mm-hmm. And at the Lee F. Jackson School, the custodial staff are in the cafeteria, and the neonates also clean the tables, and that is done in between each session while the students are either at recess and transitioning into the cafeteria.
Same at Highview, 1 custodian and neonates, at least 4 or 5 per lunch period. So they kind of each are responsible for a table.
Ms. Mayo?
My apologies, I had to unmute. And the children in the classroom size is small enough, and the children are at the appropriate distancing when they're eating. So once they're finished, the teaching assistant, they usually make sure that the tables are taken care of. And if we have any need additional support, we then will contact maintenance.
Mm-hmm.
Will the information you provided on the slides be provided in writing or online to parents?
So the reopening plan has been updated in line with this guidance, and that was posted today.
Will students keep Chromebooks at home, or will we need to pick them up if a child has to quarantine?
Mr. Ramirez.
Can you, yes, excuse me. Yes, can you repeat the question, Ivy, please? Thank you. Ivy, can you hear me?
Yeah, I can hear. I just had to find the question again. Will students keep Chromebooks at home, or will we need to pick them up if a child has to quarantine?
No, the students will keep their Chromebooks, and only in those cases that they need to be repaired or have any kind of maintenance or malfunction, then we will set up an appointment so they can drop it at the school, and then we can fix it and replace it immediately.
Will children receive regular grades this year, or is it just a pass-fail?
So those are still discussions we're in. If I could pause on that, the parents will certainly get information on that prior to grades being required and due. We are just at this point trying to open school. These are still ongoing conversations we need to engage in.
What percentage of the teachers will not be in a classroom at Woodlands Middle High School?
So the questions for Woodlands Middle, I will need to, we have them written down. I will get those to Mr. Smith and can get those back to you. I don't have that answer tonight.
How long is the lunch period at Lee F. Jackson?
Each lunch period is approximately 45 minutes.
What about ventilation at Woodlands?
Mr. Falcone?
Woodlands, all the ventilations, as I said before, all the louvers are open. So all the HV units have been serviced. All MERV 13 filters have been changed. And all the exhaust fans exactly of last year that were replaced or refurbished.
How will seating on the bus be arranged?
We're gonna load from back to front. So the kids don't have to walk past each other whenever necessary.
Will there be attendance on the buses even for Woodlands?
All schools. Even private and parochial.
Has GCSD created or distributed any vaccine information to reduce or eliminate vaccine hesitancy?
Not yet. We will be sending home resources all throughout the year, but not over the summer.
Why was remote learning eliminated as an option if the infrastructure was already built?
This was a decision made at the national level. If you recall, if all of us on this call can recall back a year ago when we were totally remote, when March 2020 hit all of us, when we had to be remote, the literature, the language, the concern became immediately around our children not being connected to school, their friends, being in the school environment. But the COVID vaccine was not in existence, and COVID was running rampant. And so schools were shut down for the safety of the children. But we know our kids suffered as a result of that. So fast forward, this guidance still knows with the Delta variant that COVID-19 is still very, very serious. But they've heard the cry, we want kids in school. They've heard that push. Children need to be in school because of the social emotional connection. So that is why we're full in person, and remote instruction is no longer an option. They're putting the responsibilities on school districts to prevent, with these layered prevention strategies, multiple strategies on top of each other happening every day, all day, simultaneously, adding on any and every time you can, pile it on is the language we receive, so that while kids are in person, we can protect them to the best extent possible. Because we found remote learning didn't work for many of our children. And that's the reason it was a national decision. It was not a Greenburgh Central. It was a decision made from the federal level to the state level and dictated down to the district level.
Are children and staff going to be asked to either vaccinate or test before school starts?
No.
Have principals named the expectation for teachers to enforce hand washing, sanitizing policy as students exit their classrooms, specifically for lower grades where students need the reminders?
You want to take that, Ms. Simone, and then Mr. Mastrangelo?
Okay, I only heard part of the question. Can you repeat that, Ivy?
Have principals named the expectation for teachers to enforce hand washing, sanitizing policy as students enter and exit their classrooms, specifically for lower grades where students need the reminders?
Yes, each classroom has a bucket of wipes and hand sanitizers, and they're constantly, that's a common practice even prior to the pandemic, that the students, we have bathrooms and sinks in each classroom, so the students are constantly wiping, washing their hands. They have the sanitizer, they have the pumps. So that is a common practice that happens throughout the day.
Same here at Highview. It's just something that has become second nature. The students have always been encouraged pre-pandemic. Up until last year, there's just reminders to wash hands often with soap for at least happy birthday, singing happy birthday twice. That's how long they're supposed to wash their hands for. And as Ms. Simone said, we too have the wipes and the hand sanitizer right at the door. So the kids are sanitizing their hands as they enter, and they can do it as they exit as well.
Ms. Mail?
Same with the early childhood program. With very young children, it is our common practice, even before COVID, for the children, when going to the bathroom, going outside, during an activity, once they're finished, for them to cleanse their hands. So this is a common practice, a daily common practice throughout the day, even bathroom reminders, because young children get very active and they forget that they got to go to the bathroom until it's the last minute. So teachers, we have bathroom reminders and we have hand sanitizing and the whole nine throughout the school year.
Since we are not getting any updates on protocols for Woodlands, can we please get the same questions addressed for Woodlands?
We will make note of the questions in the chat that for Woodlands, and I will have Mr. Smith address them upon return.
I believe Mr. Smith also indicated if anyone has a question particular to Woodlands Middle High School, they can email him directly as well.
Okay, thank you, Ivy.
Next question, if you're not testing staff, how would you know who has COVID?
So if a teacher or a staff person becomes exposed and needs to quarantine or get tested, they will be tested by an outside place like they do just right now. And that's how we find out. We are not testing staff right now. So any teacher that does get tested for COVID, it will be because of exposure to an infected person and or showing symptoms individually, which will require them to get tested on their own.
Are all students at their prospective schools, or will they be split between schools?
All students are at their well, someone wants to take that? All students are at their respective schools, except Dawn Mail, you want to talk about the ECP?
Yes. Yes. We're all at our respective places and schools. ECP, we're housing 5 classrooms at Lee F. Jackson. And largely due to the fact that the central administration, the mansion building, is not up to par for them to be there. So yes, but we've been at E.F. Jackson, this is our 3rd year, and we thank Principal Simone for her gracious offering of space and helping us to still exist and be there. I appreciate it.
Why would any teacher not be in a classroom?
I'm not clear on that question. All teachers have been assigned a class. TAs are roaming. They're not always assigned to a class. You know, we have TAs in every building, and they're assigned accordingly based on where the principal needs them. So they could be assigned to a class, but it could be assigned to several classes, could be assigned wherever they're needed in the building. But if you're a teacher in this district, you do have an assigned class that you teach. So we don't have teachers unassigned.
Since the teachers will be pushing into the classrooms, will students have breaks to stretch in between subjects? Otherwise, they are sitting for very long periods of time.
Go ahead.
So throughout the day, the students have many opportunities to move. We also have the Go Noodle. The teachers have stretch breaks. They have mask breaks. So they do accommodate the movement in the classroom. And in order to comply with the CDC guidelines, they will alternate rows. So this way the students are complying with the 3 feet guidelines as well.
So if there are no more questions, we want to close out this meeting. We want to reiterate to our community our commitment to you, our families, and our teachers and staff to assure that when they come in school and we open our doors on September 9th, that we're going to continue to work together to keep them safe and healthy while here in Greenburgh Central School District. We look forward to welcoming our students back into this year. And we thank you for attending this meeting.
Excuse me, Dr. Iverson.
Okay.
There are a few more questions, but Ms. Rossi had her hand up, so I thought she was going to address the previous question.
I'm sorry, I didn't see that. Go right ahead.
I was just going to reiterate what Ms. Simone said. We do have mask breaks throughout the day, so the teachers will take the classes outside and allow the students to take their masks off and get a breath of fresh air. And it happens during each block as well as during the special area classes.
How many kids from a single classroom have to be in quarantine before the hybrid option is made available?
Again, we don't have answers directly to questions like that. It's a case-by-case basis that is determined once we report it to the CDC and the Department of Health, and they will determine when we need to move to hybrid. We do watch and will watch the level of transmission in the community, and the percentage of how many cases are in the community. And using those 2 data points, they will direct the school in that community what we should do. We don't have an exact science or number that we use to determine when we move to any different model of instruction. We will continue to do for whole classes that need to be quarantined. Those classes will receive live instruction, but that's within the full in-day in-person model. So that's where we are right now. This is a fluid process, and if it continues and as it grows, we will get further guidance, but this is where we are right now.
Will private school buses mix different schools together?
%100%. Yes.
How often are the buses going to be cleaned and sanitized?
Once a day. If it's called for, we'll do it twice.
Are masks going to be on hand?
Yes.
Will Chromebooks be needed in the classroom?
Depending on the instructional planning, if I may, Dr. Iverson, depending on the instructional planning by the teachers, they will conduct instruction with Chromebooks or without them. It all depends on the lesson planning and all the instructional planning behind it.
Mm-hmm.
What is the requirement for proper mask wearing protocols? For example, we are transitioning from a different county and have encountered mesh masks, neck gaiters, etc.
I would have to check the guidance. I don't recall seeing any requirement for mask wearing and type of mask. We're just are mandated to wear masks. So us faculty and staff can continue to wear a mask of their choice. We have Falcon masks for our students, and so we will continue to distribute those as well as the blue color ones that everyone's familiar with. So there is no stipulation what type of mask, just that you wear one.
There are no further questions.
Okay. Well, thank you again. I want to thank the administrators for attending this meeting. I want to thank our parents and our community and everyone out there who are logged on to hear this, be a part of this community meeting. And we will continue to work together to make sure we're sure that we have a safe and healthy environment for your students when they return in September. Thank you so much again for joining. Good evening.